So, hello friends, we are talking about endocrine diseases. So, we discussed about anatomy and physiology of endocrine basics. Okay, so we will discuss important diseases regarding endocrine disorders, like which are most common in our daily life, daily practice, like hyperthyroidism, okay, and hypothyroidism, okay, and diabetes mellitus and hypoparathyroidism, okay, and hyperparathyroidism, and last addition disease, okay. So these are the some important topics we'll cover in this endocrine disorders. So let's start with hyperthyroidism, okay. Hyperthyroidism, okay, means hyper means over overworking of thyroid gland. So we know that the thyroid gland releases T3, T4 hormones. Already you studied. Okay. And that both are increased. Okay. So basically, when initial hyperthyroidism occurs, the T3 hormones primarily increases. Gradually, T4 involvement also there. Okay, initially T3 levels are increased, but later gradually T4 hormones also increases by day by time. Okay, so what are the factors affecting the hyperthyroidism? So mostly female are affected with the hyperthyroidism and adults mostly. Okay, and we have emotional stress which leads to one of the factor of causing hyperthyroidism. Okay, and over functioning of pituitary gland. Okay, means because pituitary gland stimulates thyroid gland with the help of TSH. So overproduction of TSH due to hyperpituitarism. Okay, this is also one of the disease may lead to. Okay, and fifth one is, we know that fifth one is infection. Okay, any type of infections leads to hyperthyroidism. Okay, so sometimes the thyroid glands, which are follicles present in the thyroid, will become overactive. So it becomes toxic. So it becomes toxic to the body. So it is very, very harmful. Okay. So sometimes the own glands become toxic. Okay. The own gland become toxic which leads to production of hyperthyroidism. Okay, so these are the factors. So more than male, we can say having female dominance in the hyperthyroidism. Adults are affected, and the main cause of hyperparathyroidism is emotional stress and over functioning of pituitary gland, which leads to cause excess secretion of TSH, thyroid stimulating hormone. Okay, and infection in the body. If there is infection, okay, the infection is attacked to the gland. Thyroid gland produce more T3 and T4, which leads to hyperthyroidism. And next is toxicity, okay, which leads to hyperthyroidism. Okay, so what are the clinical features now? Very important. Clinical features is first, we have more number of clinical features according to the systematic systematic clinical features, because hormones, they have effect on whole body. Okay, so if hormonal disturbance occurs, if glands are disturbed, okay, whole body will affect. Okay, so we have to see whether all the body systems are affected or not. First is nervousness. First is nervous, means nervous system is affected. So what are the symptoms? First is extreme excitement. Okay, extreme excitement. So this is the nervous system one symptom, and along with irritability. Okay, irritability. This is the nervous system symptom, and restlessness. Patient have restlessness. Okay, anxiety. It is the nervous system symptoms, and he doesn't have, or she doesn't have temper, always lose temper. Okay, in advanced cases, other neurological symptoms also appears, like speech disorders. Okay, so we will talk other symptoms also, but in the hyperthyroidism, the nervous related symptoms you can observe extreme excitement with irritability. Patient doesn't sit in a one place, restlessness, and they have anxiety, palpitation. Okay, and speech disorder. If they become more than normal, abnormal, advanced stage, speech disorder, and temper, lose temper. So this is the nervous system related symptoms. Next, we have limbs related symptoms. Okay, the patient unable to hold a glass of water, means his limbs are weak, become weak, and they will have tremors. Okay, this is limbs related symptoms, and we have cardiovascular system related symptoms. Okay, patient have tachycardia, the heart rate increases heart rate. Uh, Even in resting time also, sleep, during sleep. Okay, also the heart rate is increases, and patient have palpitation. Okay, and they have dyspnea. Okay, all this, sometimes they have cardiac failure also. Okay, and they have edema also, because excessive T3 T4 grams are glands are work thyroid hormones are working. Okay, that's the reason The cardiovascular system also working very rapidly. The heart rate increases even in resting position, palpitation, dyspnea, even sometimes in advanced case cardiac failure also occurs, and the patient will feel warm, very warm. Okay, and the patient appears with less clothing during day or night time. Because why? Because of the excess moisture in the skin, because the moisture glands are activate, large number of arteries, veins are exerting those uh, their temperature. Okay, so there's the reason the temperature is high always. And in this hyperthyroidism, the main symptoms, that is weight loss, what will happen, and fatigue. The main symptoms is fatigue, weight loss, and weakness of muscles, because the metabolic process increases. So there's the reason the patient is eating the food even though his weight become low. Okay, so this is very important. And some patients have goiter, means the swelling of the neck. This is a symptom of based on thyroid gland. Okay, and some patient have phobia, photophobia. Okay, and they have ophthalmologia, ophthalmic issues, eye issues. Okay, this is the clinical feature of hyperthyroid. Sorry. So what are the GIT symptoms? GIT symptoms like diarrhea. The patient will have diarrhea, abdominal pain. Okay, abdominal pain, and uh, the patient have other symptoms like gastritis. Okay, and the female patient, you can have see the menstrual flow in the quantity, and the duration will also diminish. Okay, so the menstrual cycle, in the menstrual cycle, the what thing two things are very affected. The quantity will reduce, sometimes increases. Okay, and duration also increases, sometimes decreases, depend upon the health of the patient. Okay, so these are the basic clinical features of hyperthyroidism. So the nervous system related symptoms you can see, limbs related symptoms you can see, clinical features, CVS related clinical symptoms you can see, and we have weight loss. This is very important clinical feature with fatigue, weakness of muscles, and goiter, and we have eye problem, diarrhea, and along with menstrual cycle issues. So these are the clinical features of patients. What are the signs you can see in the patient? Okay, signs you can see, patient, we can see that the patient is very anxious, and you can able to see that she or he is ill person, any disease occurred to her, and you can see her skin is warm and moist always. Okay, goiter is there. Okay, I already told you that you can feel the if you palpate that, you feel a beat here. This is very important. And nodules, okay, some nodules you can see, and the nodules very hard. Okay, sometimes you cannot able to see in initial stage. Gradually they will appear. Initially, you have to go through with blood test. Okay, and the heart rate is very, very high, sometimes 120, more than 100. Okay, and you can feel the you can feel the heartbeat also when you place your hand on the apex side of the heart. Okay, and blood pressure is also slightly high. Okay, and temperature is high. Okay, and these are the some signs you can observe. Okay, in the after, if it will become to the advanced level, they you can see the failure of eyes also, unable to move the eyes, the vision is affected, and the facial paralysis also occurs sometimes, and or the eyelid issues also occurs, facial muscles affected, eye muscles affected. Okay, all these problems you can see during the advancement stage of hyperthyroidism. Okay, and sometimes the eye will become swell. Okay, these are the symptoms related uh, hyperthyroidism. What are the diagnosis purpose? We have to check. We have to see the T3, T4, and TSH level. So mostly in the hyperthyroidism, T3 and T4 levels are high, TSH levels are low. Sometimes it may be high also. Okay, mostly T3, T4. Okay, and you have to check the serum protein levels also, to check the protein levels and serum iodine level also, because if the iodine levels are also high, this problems also occur. So you have to see that. Okay, so sometimes it may be lead to cancer of thyroid gland also. So all this we have to remember, and according to that we have to treat the patient. But what are the basic fundamental uh, glandular remedy? Okay, you can advise S2 L1 BE. Okay, next is C2 When1 G. Okay, we have to start with D6, sorry, D6. Okay, and with all the symptomatic, according to the, you have to add other remedies also. Okay, but it is very uh time taking treatment, because a whole gland is involved, whole gland is involved. Okay, you have to take the time and ask the patient, they have to take the time to treat completely, and complete diagnosis, complete evaluation is needed. Okay, and secondly, sometimes is genetic based disorder also. Okay, sometimes it is by birth disease. Okay, so all these complications you have to explain the patient and tell them this is very, very difficult case, but we are trying, you will get the best results, but you have to follow our instructions. Okay, so very, very important. And according to, if you want to release the thyroid toxicity, you need to give SLAS also. Okay, in mostly in D4, or start with D5. Okay, and along with, you have to advise C17 also, C17, which will also remove the toxicity from the body initially. When the toxic effects reduces, you have to gradually stop these remedies, or else if you have to continue one remedy and another, you have to stop alternately. First 15 days start with SLAS, then after C17, then again start SLAS, till the effect of thyroid gland. Due to that effect, your body will giving the hint that this person is affected with some disease. Okay, till that you have to follow this remedies. Then afterly, gradually, you have to reduce that, and uh, you have to apply the apply application also sometimes needed. F2. Okay, F2, S2, B. Okay, if the swelling is the B, then you have to convert with G for healing process. Okay, functional healing, then structural healing. First, structurally, you have to reduce the globular size. Then, functionally, you have to treat the gland. Okay, so basically, thyroid gland is increases. So, thyroid is lymphatic temperamental organ which producing the lymph. So, lymph producing organ is affected. Okay, so you have to select the lymphatic remedies. After that, what will happen? You have to check the patient temperament also. Okay. Sometimes what will happen? The sanguine temperament patient having thyroid problem, but according to our assumption, the patient has is affected with thyroid gland. But the problem is in sanguine temperament. The blood circulation to the thyroid gland is affected. So there's the reason the thyroid gland is affected. So we have to check whether the problem is in nervous system or in blood circulatory system or in liver or in bone marrow. Okay, all this you have to calculate. Then afterwards treat the temperament according to temperament also. So you need both glandular treatment, temperamental treatment, and symptomatic treatment to relieve from the this type of diseases. Okay, so this is all about. Okay, in today's topic. If any doubts, kindly ask.